When it comes to aging, many of us share a significant fear, the fear of developing dementia. This degenerative cognitive condition can profoundly impact an individual's quality of life as well as that of their loved ones. According to the CDC, approximately 1 in 9 people aged 65 and over in the US suffer from Alzheimer's disease, the most common form of dementia. Alzheimer's is marked by the depletion of nerve cells in the brain's cerebral cortex, affecting memory, language, and reasoning. Early detection of dementia is crucial, as it can help identify underlying causes and potentially prevent more severe symptoms. A recent study by researchers at the Albert Einstein College of Medicine of Yeshiva University and Montefiore Medical Center found that individuals who tested positive for pre-dementia were nearly twice as likely to develop dementia within 12 years. The study introduced a test to measure motoric cognitive risk syndrome, or MCR, a pre-dementia indicator characterized by walking speed and cognitive complaints. Nearly 27,000 adults aged 6 years older from 17 countries, none of whom had dementia or disabilities, participated. Of these, 9.7% tested positive for MCR. Researchers then focused on 4,812 participants and monitored their health over 12 years. They discovered that those who tested positive for MCR were almost twice as likely to develop dementia during this period. Senior author Dr. Joe Verghese noted, "Our assessment method could enable many more people to learn if they're at risk for dementia. Since it avoids the need for complex testing and doesn't require administration by a neurologist, the potential payoff could be tremendous, not only for individuals and their families, but also in terms of healthcare savings for society. All that's needed to assess MCR is a stopwatch and a few questions, so primary care physicians could easily incorporate it into their examinations of their older patients." The researchers emphasize that slow walking alone is not a sign of pre-dementia unless accompanied by cognitive complaints. Regarding dementia prevention, Dr. Verghese stated, "Even in the absence of a specific cause, we know that most healthy lifestyle factors such as exercising and eating healthier have been shown to reduce the rate of cognitive decline. Additionally, our group has shown that cognitively stimulating activities like playing board games, card games, reading, writing, and dancing can delay dementia's onset." In a recent article, we explore research indicating that a program combining physical exercise, cognitive exercise, and meditation showed promise in improving existing dementia symptoms. This suggests that for prevention, keeping both the body and mind as active as possible may significantly help in preventing the illness. Heart health is also crucial in preventing dementia. Research has found a correlation between heart disease and an increased risk of dementia in older women. Eating a diet of whole nutritious food, exercising daily, and reducing stress are integral to maintaining cardiovascular health. If you wish to take an MCR test, talk to your physician about its administration. While more research is forthcoming, this study suggests it may provide valuable insights into your dementia risk.